Small world. All right, thank you so much everyone for joining. We're gonna go ahead and get started today. So welcome to our June CHPRMS Coffee and Communications event. My name is Carly Gabriel and I'm a CHPRMS board member, and I also do research communications for UNC Chapel Hill. Please continue to introduce yourself in the chat and let's get to know each other and see who else is from Mount Airy. All right, so before we get started with our discussion, I have a couple of things that I want to run by everyone. First, we invite you to become a CHPRMS member. We have events like Coffee and Communications and also Lunch and Learn, and you'll get access to our member database, networking opportunities, and a discounted conference registration. We also have a brand new website. It's beautiful, and I'm very proud of our team for completing that. So please go ahead and check out that new website and sign up to become a member. And that leads me to our annual fall conference. We're celebrating 50 years of CHPRMS this year. It's a really big one. This year, the conference is happening a little earlier than usual. It's happening in October from the 18th to the 20th, and it'll take place in downtown Asheville, North Carolina. And registration for the conference is open, and we hope you'll get your tickets soon to take advantage of that early bird discount. And of course, our conference would not be possible without all of our wonderful sponsors. And today we're highlighting Reason One. Reason One is a full-service digital agency partner to health systems and organizations, keeping websites and digital teams ahead of disruption. They provide strategy, content, user experience, design, and development to create a consumer-centric digital experience that builds trust with patients. Thank you, Reason One. And you deserve some recognition for all of your hard work as well. We invite you to submit nominations for the Wally and Golden Tusk Awards. It's CHPRMS' way of recognizing all the amazing work our members create. And if you've ever wondered where the Wally and the Golden Tusk names come from, check out our new website. We actually have the backstory there. There's a little tease for you, just trying to push you to our new website. But it is very interesting. All right, now on to this afternoon's speakers on recruitment and retention. First, we're going to have Kendall Watford, Senior Campaign Manager in Human Resources for MUSC Health. We also have Kathleen O'Neill, Communications Manager for UNC Health's HR Administration. And we also have Diet Casey, Communications Strategy Director for Roper St. Francis Healthcare. And Kendall, we're going to start with you first.
Thank you so much. All right, let me get my screen share. All right. There we go. Looking good. All right, thank you for that introduction. My name is Kendall Watford, and I'm here to talk a little bit about recruitment marketing at MUSC Health. And so if you don't know us, hopefully you do, but we have 16 medical centers now with over 2,700 licensed beds, about 750 care locations, 26,000 employees, and 3,000 job openings at the moment, but that's pretty much standard on average every month, how many we have as of late. And then a little bit about me and my role. So I started 2 weeks before the world shut down for the pandemic as a digital marketing coordinator. So I worked with our social media presence and in the thick of COVID. And then in 2021, late 2021, I was promoted to Senior Campaign Manager for Human Resources. So my background's a little bit different, I think, than other recruitment marketing roles. I am on the marketing team, but I work with our HR teams across the health system. And then in October 2022 is when we actually launched our new career site and transitioned to Workday. So our entire organization changed our ATS, our applicant tracking system, and we launched a new career site on top of that. So a lot of change all at once in late 2022, and we're still figuring it out a little bit. But I always like to share this funnel. This is from our from Clinch, which is our recruitment marketing system and career site. showing kind of the difference between the funnel that we're used to in marketing versus the funnel for recruitment marketing. So we're, of course, trying to drive applications, trying to, of course, increase hires and qualified candidates. And so it's a little bit more like a marketing and sales relationship, I think, than what the rest of my colleagues are doing on my marketing team. So they're trying to drive appointments, trying to get patients in the door. And so what my objectives are, and of course what our tools are a little bit different than typical marketing. I think recruitment marketing as a whole, the tools aren't as robust as in consumer marketing. So it's certainly, we're learning as we go, as we're trying to build a foundation for recruitment marketing at MUSC. So first, we tried to just build a strategy, an annual plan for our recruitment marketing objectives. And so these are our overall objectives. And previously, so since we've been in this transition period, switching to a new applicant tracking system with a new career site, we finally have some data that we can actually back these up with. So I'm excited about the next fiscal year and the next annual strategy that we build to continue to measure on these KPIs, but certainly trying to build our employer brand, increasing awareness of our open positions, improving our online presence, of course, and influencing those candidates to consider us as an employer, and then ultimately increasing applications and hires. Yeah, so in layman's terms, I like to put it this way. Just we want to make sure we're showing up accurately, displaying our culture, what it's like to work at MUSC, and then shifting our mindsets to think like candidates. So I think similarly, we do this on the patient side, trying to put ourselves in our patient's shoes, but then flip it to shift our mindset to think like candidates, not just selling ourselves and talking about who we are, but thinking about what they really want from us as an employer. So that foundation, just like in marketing, is our career site. So I think we're still working on building and optimizing our career site and our candidate relationship management system, but we are finally, I think, moving in the right direction, automating some emails and nurturing campaigns, able to build landing pages using this system, and just really trying to tailor that content so that it's more candidate-centric. And so all of these other pieces, Glassdoor and Indeed, LinkedIn, and Google for Jobs are just other ways for people to find our jobs and find MUSC. A lot of our content prior to me being in this role was out of date and kind of scattered and fragmented. And so we're trying to centralize and get us all on the same page across the health system, since we've had a lot of growth in the last 5 years. So we've had a lot of different teams working in different ways. So trying to get us all underneath the same employer brand for MUSC Health. So refreshing and updating that old content and just making sure we're using all the tools that we have. So yeah, foundation definitely is that career site and just making sure people can find our jobs and get the information that they're looking for. So far, since October 2022, this is our overall performance. 85% of our site visitors are starting an application, but only 69% of those are completing it. And so this is something I'm exploring with our Workday team to see, where is that drop-off rate? Why aren't people completing it? How can we get people to come back and continue to complete the application? And then of those, 73% become candidates and only 12% get hired. So that's another question. What's going on with those candidates? Is it the quality of the candidates? And so we're just finally have access to more of this data to see where people are looking and what they're looking at. And so we're excited to continue to act on it. But our hired to application started ratio is 1 in 16. So 1 in 16 people who start an application get hired. And so, like I said, we've only had this data since October 2022, so I'm excited to continue to build on it and iterate on it. But what's next for us is certainly continuing to optimize all of our many tools, develop more pages on our career site. My ideal state is a careers blog, as soon as we have a little bit more bandwidth, and start sending out a newsletter with some of that content featuring our employees and just our culture at MUSC. We're testing programmatic advertising opportunities as well in the next fiscal year, and just finally excited to use that data now that it's available to fine tune our strategy. But I also wanted to add to since my position was created because our marketing team didn't have the bandwidth to help our HR team in such a strapped market for jobs and recruitment in general. So ways that marketing can help, without necessarily having a new person to assist HR is, just thinking about incorporating some of recruitment CTAs into existing marketing materials. Tried to emphasize this a little bit with our team. Of course, we're focused on patients, but if there's any time that we are featuring one of our care team members or an employer, if we can throw in a little join our team or explore our jobs CTA into any kind of marketing materials we already have, that's a good way to help just drive traffic to that career site, creating templated materials that the HR team can use. And then, of course, featuring employees as much as we can, and featuring just focusing on our culture as much as we can in other marketing materials that we're already producing. And then, of course, offering support as bandwidth allows. But I know marketing teams, I think, as well as HR teams, are historically under-resourced. So just we're all doing the best that we can. But certainly these are ways that you can help as a marketing team. But thank you. That is all I have.
Thank you so much, Kendall. Personally, as a science and research communicator, I love data. So I think it's really, really neat to be able to have that data from the entry point all the way to being hired. So it's really, really interesting. Thank you.
Yeah, thank you. And it's exciting when we've never really had it before, the full picture at least.
So, yeah, absolutely.
Thank you.
All right, so next we're going to have Kathleen with UNC Health.
Okay, let's see. Okay. Hi, I am Kathleen. Thanks so much for having me here. Wanted to tell you a little bit about what we're doing at UNC Health around engagement and retention. First, I'll start a little bit about me. I am not from Mount Airy, as many people seem to be on this call, but I am originally from Ohio. Go Buckeyes. I went to school in Bowling Green, which is near Toledo, and graduated with a degree in journalism and public relations. Prior to moving to North Carolina a few years ago, I was in Long Island for about 12 years. I have more than 25 years of experience in communications and marketing, the last 13 in healthcare. I've worked for a couple healthcare organizations before UNC Health. Most recently, I was at Duke Health. And then prior to that, I worked for Northwell Health in New York at Long Island Jewish Medical Center. I joined UNC Health. This week, I've celebrated my year anniversary. And the role was a new one, located in internal communications, but supporting the HR team. So my role is to support communications, and also we have a people strategy that was rolled out last year that I was brought in to help with as well. And I'll go into that in a moment. Just a little bit about UNC Health. It's North Carolina's largest academic health system. We've got more than 40,000 teammates. We've got owned and managed entities, so we have state teammates and then NC Health teammates, 16 hospitals, 20 hospital campuses, and more than 500 clinic locations. So I had mentioned a people strategy in January of 2022, just with so much going on, as everyone's been experiencing in the industry, the environment. There was a lot of vacancy rates going on, individuals leaving the organization, burnout, some of it as a result of the pandemic. So the board actually was saying we need to concentrate on our people and we need to strengthen our position of employer of choice. And it was a really quick process as far as identifying the need to put this people strategy in place and then launching that people strategy and implementing it. So we partnered with Deloitte to help us look at how we could build this foundation, leveraging the information that we had to date and developing a roadmap for the overall strategy. So as I had mentioned, we had commitment from the board. So to gain this alignment, we partnered together with human resources and internal communications. And I had mentioned that I'm a member of internal comms, but I sit within HR. There was a lot of collaboration among stakeholders, and there were fact-finding focus groups put into place to identify any type of gaps as far as what our culture was experiencing. What can we be doing to help strengthen that experience for teammates? So what came out of this focus group, or the overall effort, was our framework, which is what we call UNC Health for Me. And this is our people strategy, or what we consider our commitment to teammates from recruitment to retirement. And it's based on 6 pillars that we've established. So you can see them on the screen. Engage Me is where we want to nurture a sense of belonging and cultural identity for teammates and make them feel connected and part of our one great team, which is one of our values. And also all of these pillars support our mission and values and are part of our efforts to embrace and elevate culture. So other pillars include Welcome Me, where we want to create that positive, inclusive experience from recruiting and then throughout their entire first year with us. Develop Me focuses on a teammate's growth and overall development and professional experience, looking at career mobility. Value Me fosters a culture where we're upholding Carolina Care, one of our values, and making sure everyone's feeling rewarded and recognized. And then we've got Care for Me, where we're taking care of those teammates, both professionally and personally. So talking about their safety and respect, as well as their health and well-being. Oops, I hit my thing. And then we've got the final one, which is Include Me, making sure that our teammates are seen, recognized, and feel inclusive. So these are pillars that we have organized all of our initiatives around. And in doing that, we had to create a communication strategy. So we had this framework. What do we do with it? So we had to put together an awareness campaign, looking at how do we promote our existing talent benefits internally and develop a strategy for that, and then put together a roadmap. Here are all the projects and initiatives that we have going on across the organization. How do we align them under the pillars? How do we communicate them? How do we govern them and ensure that everyone's on the same page with us? And it was really changing the philosophy and reinforcing that everyone had to work together and all stakeholders are affected. And it's not just HR's responsibility. It's not HR that owns the project or the people strategy. It's the entire organization. So here are a few examples of what we call UNC Health for Me in action. So upon releasing it, we created a new intranet site, UNC Health for Me. We actually rebranded our workforce engagement survey to call it Share Your Voice, Your Experience. And that's actually going on right now. We launched it last week and it's ending next week. And that's around Engage Me. So each of the pillars that we use, we use them for the messaging. So for example, in the middle, we've got a couple examples of our newsletters. So we have Include Me, and it's identifying a topic around how we're having sacred spaces available for teammates, or we're celebrating International Infection Prevention Day. That's around Value Me. So these are just a few examples. We have a program called On the Road with UNC Health for Me, and there's some cupcakes there where our culture and retention team goes out and visits our sites and entities and helps explain what's going on with the pillars and how we can promote and support the teammates. So that was just a fun idea or way to promote it. And then lower left, you see goals. We've incorporated these pillars into our goals to help promote that throughout the organization. Here's another example of an HR annual report that we rolled out last year, the first time that we were able to kind of organize everything around these pillars and demonstrate to the teammates how we're working to improve the experience for them. Also, we do quarterly updates within communications for HR. So these are also organized around those pillars, and you can see some examples of under Value Me, we completed position and equity reviews. Welcome Me, we've got some new benefit summaries, a new video for the teammate experience. And these are really helpful to help promote pillars and the strategy throughout the organization. Another way that we're doing that is we've identified pillar recognition weeks. From a system standpoint, we're pushing these out and encouraging all of our entities to participate, and that's just another way to embed it throughout the organization. And in July, One Great Team Day will be part of our engagement week, and we're excited about that because one great team is one of our values. So as far as implementing the plan, we're really focused on the teammate experience and what it is that we can do to enhance every touch point to make sure the teammates have a world-class experience from recruitment to retirement. Everything that we're looking at, we're trying to look through the eyes of the teammates. Just as, you know, we mentioned the marketing side is looking at the patients. We want to focus on the teammate experience. We're also providing tools for our leaders because we know that leaders are an important part of retention. There's many parts to retention, but one of it is, you know, the role that the leader plays and how they're encouraging the professional development, interacting with teammates. So we've created a Retention Starts With Me campaign to provide leaders with those tools and resources that they need to support their teams. And I'll go through a couple of the tools that we're using for leadership. The campaign really, as I mentioned, is offering programs. So there's professional development programs for leaders to understand how to, you know, interact with teams, professional development for the teammates. The resources are, we have discussion circles, we have videos, and we're asking leaders to take one or two of the things that they've learned and put them into practice. And that's actually part of our organizational goals under retention, that we're asking the leaders to attend one or two of these retention seminars, workshops, whatever it is, and then put it into practice and come back and share it with us. We also have another way that we're supporting leaders through the use of technology. There's a platform called Bodio. It's an online engagement, recognition, and retention tool that we've partnered with this organization. It was created for healthcare leaders. At UNC Health a few years ago, our clinical and nursing teams adopted the platform, and just recently we've rolled it out across the entire organization. And so really it's a tool that integrates with existing tools, so it can integrate with Outlook, it integrates with time and attendance, and it can help managers keep track of their teams. So if on the clinical side, maybe a nurse manager had an employee that was working lots of double shifts, or she could look and see she was picking up some shifts and covering for others, it would alert her, send her notices that she could go and follow up on that nurse to see if he or she was doing okay. Was their well-being all right? How are they doing with these extra hours? So it's a way to send messages, but it's also a way to identify any risks for retention if we're at a risk of losing someone based on, you know, some of these factors that would play into it. And what's also great is we've been able to incorporate our pillars into some of the work stream as well. So we've got welcome me templates within the system. So a manager can just go in and select that template and send a message, but they also have the opportunity where they can customize it to themselves. So based on their style. And it also tracks any professional development conversations and documents reminders. So it's been a really helpful tool. We are the first healthcare organization to roll it out throughout our entire organization. So it was originally intended for clinical staff, but now non-clinical staff are using it, and we're excited to see where it takes us. So as far as measuring results, we've got the results that we look at teammates and leaders, and we get feedback from them. But then we've also created retention dashboards for leaders where they can go in, take a look at what industry standards are around retention, look at what retention is for their specific team, and then higher up, a leader can look at something more broad for their entire organization. We're also tracking participation in these leadership educational programs. So what's next for us? We're going to continue to integrate UNC Health for Me in our daily operations. We're also getting ready to look at what we can do for recruiting. So I feel like, Kendall, I'm going to be following up with you to get some tips and tricks about what's going on there. So we've started to embed it throughout the organization, but we want to also share it externally so there's more of a consistent experience for the teammate. We'll continue to get feedback from teammates and leaders, develop more transparent manager dashboards so they have the information that they need and they can make informed decisions. We're looking at talent mobility, talent development, career mobility, what we can be doing to bring in new talent, but also support the development of our existing teammates, and look at more ways to enhance the experience using technology. And that is it.
All right, fascinating is my word of the morning. Thank you so much, Kathleen. That was great.
Thank you.
Thanks for the opportunity. To let everyone know, we are going to have a Q&A session with all of our presenters. We just want to go ahead and get through all the presentations before we start that. So thank you again, Kathleen. And finally, we have Diet.
Oh my gosh, Carly, I said, hey, just say your favorite words. Can you hear me? And then it was silence. So I did it again, 2 times in an hour. I think I get an award now for that.
We started out the session today with me telling Diet she was on mute. So yeah, we did it again.
Like, let's see how many times someone can tell me that today. So hey everybody, you can see my screen and you can hear me. This is all very exciting. I am the Communication Strategy Director for Roper St. Francis Healthcare in Charleston, South Carolina. The benefit of going third on this presentation panel today was that I could see that everybody else had slides about who they were. I didn't, so I added it in here. Roper St. Francis Healthcare is a private, not-for-profit healthcare system in Charleston, South Carolina. Like I said, these are some of our stats from 2022. We have 4 hospitals, more than 100 medical offices across 3 counties. A little look at who we are. I do not have a slide about who I am, but I can sum it up really quickly. I was a journalist for 12 years, came to Roper St. Francis about 9 years ago, and have been a part of the corporate communications team, have gotten promoted a couple of times, and my realm is really just internal communications, corporate communications. Shout out to the other 3 people I see on this call, Kelly and Mia and Mary Ruth from the Roper St. Francis team. Thank you for being here. So I guess I should start, like, Kathleen and Kendall, your presentations were amazing, and I feel like mine's going to be a little underwhelming in comparison, but I'm just going with it. We do not have anyone for as big. I mean, I feel like we're pretty decent size. We're not as big as MUSC or UNC Health, but we do not have a communications or marketing teammate, colleague dedicated to HR, retention, or recruitment. Like, this is just part of what we do. So I'm coming to it as more from a generalist perspective, I would say. Like, HR is one of the things I do. It is not in any way the thing I do. So again, like we've talked to, you know, everybody knows the challenge of retention, but where it comes in for us is that we saw an upward trend in our first year turnover rate. Historically, we have been below the national average, which is like 25%, but we've started to see that tick up. So I threw our strategic plan slide up here. I'm not going to talk about this long. I just wanted to show, I mean, this shows our vision for the next 10 years. It's very important. But what I wanted to point out on here is that creating a culture of engagement is a key driver of this plan. And that engagement is really about creating a place people want to be and want to work. So obviously, if they're leaving, this is a problem. So our leadership this year, these are our top 5 priorities on our corporate scorecard. These are the things that this year our leadership team said we really want our leaders specifically to work on. And when I looked at this list, it jumped. I mean, my chart activations is another one that I feel like we have a big impact on. But first year turnover was like, I can help with that. I can do something about that. So we created a communication plan. No one asked us to do this. We just saw it as a system goal. So it made sense, like we should be working toward this. So again, our goal specifically wasn't, I'm talking pretty narrow here, first year retention, promoting the visibility of our first year teammates. And then again, I think that Kendall said this, emphasizing the role that we all have in their retention, that it's not just HR's job. So these are the tactics. I'm going to go through these one by one in more detail, but just generally, this is what we're working on right now. We just started this again, like March maybe. So the thing that's missing from the presentation are results. Fingers crossed that we help impact our first year retention rate. I don't know yet. I mean, because we're just starting to do all these things, but I'm hoping that it helps make a difference. So first thing, you saw on the previous slide, it said concert ticket giveaways. So we have a partnership with Credit One Stadium here in Charleston. We have a concert series there, and we sponsor it. And so as part of that, we bought tickets to shows like Kenny Chesney, Luke Bryan, Chris Stapleton. I realized that not every place is going to have a partnership, with a stadium with concert tickets, but we've really tried to use these tickets to leverage our goals, right? Like, how can we use these to help, help encourage progress toward these? So what we did was we said, okay, teammates, if you share photos of or stories about people in their first year and what you share photos of people in their first year and what you like most about working with them. And we also asked first year teammates, like, share who or what has been valuable to you in your first year and why. And I realize the slide is not very engaging. It's hard to read, but this is just kind of what it looked like. We got dozens and dozens of submissions from both first year teammates talking about who has been helpful to them, and then as well as people talking about the first year teammates they love. And again, like, this is what we're doing, is trying to build culture, trying to build something where there's an awareness and where they're talking about it. And these have been great. I mean, it makes you feel good to read these. So again, if you don't have concert tickets, is there something else you have? Do you have some branded swag you could give away? Do you have something else that you can incentivize people to share? Because I think that incentive it gives them that little prompt to, like, okay, I'm going to do this. So another thing that we've been doing is trying to get leaders to share. We didn't give them any incentives. We just kind of put it out there to leaders, like, share your first year, share your best tips and tricks. Like, these are our experts, right? These are the people that do this every day. And so it's been amazing to see what we've gotten. Like, one of our VPs, we didn't even seek this out. Like, again, we just put it out generally, but she came back with this, like, top 10 list of things that she does. And it was so powerful. And she was, I mean, I think we had about 10 people submit different stories, different leaders submit their different tips. It made me think we should probably go back and ask our other VPs, like, more directly, what are they doing? But again, this is something that we just circulated among leaders to talk about what are ideas and suggestions. Something Mia has been working on. We wanted to show, one of the things we've been working on is showcasing teammates who have been here for a very long time. So we identified our teammates who have been here for 45 years or longer. We have, I think like a dozen or right around that. I mean, it's a significant number, I think. And so we're profiling them. We're asking them if they want to talk to us about why they've stayed. And again, it's creating that awareness, helping encourage that culture of, like, this is a special place. and she did this great Q&A with this woman who was here for, she was here during Hurricane Hugo, and this woman, she just had the greatest of details. She talked about seeing, just slight tangent, talked about seeing shrimp in the couches after the storm came through. But anyways, it was just, it was gold. It was such a good Q&A, and we're sharing that. Operation Flow. This is something that HR started back in 2016. I'll get to our role with this real quick, but basically this is the top thing. That's like, those are our badge holders, right? And so they started giving everybody these life preservers. And the reason was twofold. One, you wanted to create an awareness that these people were new. And then two, encourage people to like, talk to them, right? Like, welcome to Roper St. Francis. Is there anything I can do to help you? How's it going? That kind of thing. And at the end of the first year, that's supposed to be like a big deal when you give away your life preserver. You give it away to someone that has meant a lot to you, that has helped you the most over the last year. Well, like, the execution of the program has left a little bit to be, I mean, it's hard, right? I mean, this is something we started, but it's like, how do you continue that momentum? Well, we're going to help HR relaunch this program. At our upcoming LDI, that's our gathering of all of our leaders, we've asked leaders who started a year ago to identify people they want to give away their life preservers to. We're going to make this a big moment at our LDI, right? We're going to showcase them giving away their life preservers to the teammates who have meant a lot to them. We're going to do video. We're going to write stories about it. We're going to share this with leaders. We're going to share this with the organization. And again, it's to create this awareness. This is a big deal. And then every month we have a presentation deck that we send out to our leaders with key messages that they should be sharing during staff meetings. And we're going to have a placeholder slide for, double check and make sure you don't have anyone, or see if you have someone who needs to give away their life preserver. We're going to, again, hyperlink tease to all this previous content we have about why this is a big deal, and then encourage them to continue doing this. And if they do it at their meeting, share those pictures back with us so we can share them with the rest of the organization. Again, we want to just continue to make this, to elevate this to everyone's consciousness. And then coming soon, I don't have anything on this because, again, these are just ideas that we're working on right now. Videos, we want to do some, have some different mediums. So a lot of what we've done is print, but we also have some fun video ideas. Have like a new nurse interview an experienced nurse talking about things that are changed, things that are different. We have top 10 lists. They're all these video ideas are geared toward like a first year audience, but they're supposed to be fun that other teammates would want to watch too. Like top 10, like a Letterman style top 10 list of the best things, best tips for your first year, but sort of fun. And then automated emails. Our teammates get, automated emails the first few weeks they're here about like, don't forget you've got to do this, don't forget you've got to do that. We're creating hopefully a campaign that will last their entire first year of like, all that stuff you get in orientation and you're overwhelmed and you can't process it all. It'll be kind of that content over a year of, where can you get, did you know this about your benefits? Did you know that you have access to the employee assistance program? Did you know that all of our policies are right here? And this is where you should go if you ever have any questions. So again, just to continue that like information sharing over their first year. And that's all I have. Thank you.
Thank you so much, DeEtte. All right, so now we'll just open it up to questions. You can speak up if you have a question. You can raise your hand. See, Kathleen already has. Oh, she's doing the clapping. That's great. I need to learn to recognize hand signals. So you can raise your hand. You can pop a question in the chat. And Christy asked a question in for Kathleen, so I will just get us started with that question. Going back to your employee survey, Kathleen, what strategies work in getting employees to actually complete the survey?
Oh, good question. And our goal is 90% participation. So it's a big goal. One thing that we do is we've created a share squad. So we used to call them survey champions. There's probably over 1,000 of them across the organization where they're identified to help support the survey and promote it throughout their team. So the Share Squad is using all kinds of crazy ways to get people to participate. The latest one that I saw is that one of the leaders dressed up as Cher because the name is Cher, and so they have the character, celebrity Cher. So they're doing some promotion around that. Everyone's doing some great things. They're giving away ring pops and say, let's get engaged. They're having pizza parties to promote, competition. They're doing a share battle between two of the nursing units that whoever wins gets this like wrestling belt that's been bedazzled. So I think it's been really great to have the buy-in from the teammates where they're coming up with great ideas that will connect with the people that they're working with. Also, we're setting up, knowing that not everyone has access to a computer all the time. We've set up stations throughout the entities where people can go in and take their survey. It's available on your phone to take it. I'm trying to think what else. We've got tips, so we've got videos to help support it, key terms, FAQs. We provide huddle flyers. So if people are having their safety huddles, there's a flyer that someone can print out or they can post it in a break room. So we're doing digital signage, anything that reaches the different channels that we have. We even did a little bit of social media too. So I think it's varied, knowing that people are working in different places, but it's been wonderful to have that share squad and also support from leadership too.
Yeah, the Share Squad is genius. Really, really like that.
Yeah.
Any other questions? Well, I actually have another question for you, Kathleen. So with your messaging based on all of your pillars, is your audience, your employees, are they able to identify the correlation between the messaging and the connection to the pillars? And does that matter? Is it more for your direction for your team?
It does matter. And they are starting to identify it, and we're getting a lot of buy-in from different areas. So we have pockets of it. So everything that we're pushing out, we're associating with a pillar, programs, initiatives, communications. We're encouraging leaders at the different entities to do that within the teams. We've got more adoption in some areas versus others. So it's resonating in different areas. We've got the icons associated with each of those pillars. So it's fun and scary at times to see people promoting it on their own. They'll create a lunch and learn and they'll slap an icon on it. And I love that, but then I get really cringy when I see, oh, it's out of proportion and it looks crazy. So I love it, but sometimes I'll go back and say, hey, this is great. Could you use this template? So we provide Word document templates. We provide a PowerPoint template. We let them have those icons, but try and give them tips on how to use it. So I think that, and it's only been a year since we launched this. So I think that we've been able to accomplish a lot, but there's so much more we can do. And, we do have areas where leadership, I had mentioned this before, some leaders think it's just an HR strategy. So we're trying to kind of shift that understanding and promote it more. So pillars are very important and we want people to be able to identify with them.
Thank you, Kathleen. All right, again, if anyone has questions, go ahead and ask them or put them in the chat. I know that we had a lot of information in today's session. I actually have a question for Kendall. Kendall, I know with researchers, they hate to make assumptions about data, but I'm going to ask you to make an assumption. Do you have any ideas about what could be causing that drop off from, I think it was like in the 80% number of applications filled out, and then maybe all the way down to 12% or so for employees that were actually, or applicants that were actually hired? Do you have any assumptions about what's going on in there?
Yeah, that's a great question. Well, for one, our application's really long generally. And I also found out in investigating this that so just switched to Workday. So I think we're still figuring things out with Workday for sure, but found out that it's not actually connected to Google Analytics or anything like that. So we don't know where people are dropping off. So that's something I'm working on, trying to figure out if we can pull that in Workday. The reporting has been, we're working on setting all that up in Workday still too a little bit. So I'm trying to figure out where the drop-off rate is with the application. Now, as for completing applications and the candidates, haven't quite made it there yet, but we need to investigate that further. But I know one thing we're working on is trying to have an auto nurture campaign so that when people start applying, to follow up and remind them to come back and finish that application. So that's something that is not automatically happening in Workday right now. So we have two systems. So it's like, figuring out the differences between the two systems, making sure we're not overlapping, and over communicating with our candidates, but also making sure they are getting through that funnel. So that's a great question.
Thanks, Kendall, for that insight. All right, seeing no other questions, I'll continue with my questions. Diet, I have a question for you. So since you don't have a dedicated team member for the campaign that you are doing, how do you balance that? And maybe how do you get buy-in from superiors that this is something worth dedicating your time to?
That's a good question. I think I think it helps that it's a corporate scorecard goal, right? And that this is you can tie it back to our strategic plan. I mean, since we started down this path, there's been nothing but support. It's like, oh yeah, we should be doing more of this. So, how do you make time? That's the bigger challenge. I mean, using project management tools. I mean, that's sort of how we live and die around here, is just trying to make sure that you're setting reasonable deadlines and then holding yourself accountable, because there's no one holding really you accountable to do this. But it's just, I don't know, you just know it's the right thing for the organization, so you just do it.
Well said. All right.
Carly, this is Amy. I have one more question. How do you all in recruitment and retention find that video to be an effective tool when you're recruiting candidates? Like, is there an aspect of sharing videos back and forth with potential candidates? I've been interested in that from like a content creation standpoint. Like, is that a tool that helps your recruitment efforts?
I can speak to it a little bit. That's a great question, and honestly something that I feel like we haven't fully broached because of bandwidth issues, truly. And I know we've been trying to do it more organically on Instagram and TikTok, trying to get people to submit videos. Because I think that's something that we have a challenge with, is it doesn't have to necessarily be a professional video with our videographer, since we have, just one really right now. So I think trying to put it back on our employees and say, yeah, send us a video, take it with your phone. You got a camera in your pocket. And so that's our struggle has been, resources when it comes to video content. But that is something we're working towards, to continue featuring testimonials, using videos and things like that. But that's been one of our number one things we've tried to do with Reels and TikTok. So our short form video content has been a lot of featuring our care team members. So good question. Not quite measuring from the funnel with that yet, since it's mostly organic, but would like to work towards doing a better job of measuring that.
That's helpful, Kendall. Thank you.
Yeah, thanks, Amy.
Jiet or Kathleen, did you have anything to add to that one?
No, it's funny. Amy and I work on the same team, and she's been doing a lot of, she's been contacted to do video and content. And I feel I mentioned earlier, it's an area that we need to get more involved in. We've got a sourcing and recruiting team within HR, but we don't have that like focus on recruitment. Well, they're not on the call, so I can say this. They're not really focused on recruitment marketing like we would like them to be. So I'm really envious of what Kendall's got going on.
Well, I don't know. I have a lot of, because I work with all of our recruiters across the health system. So sometimes I just am like, I need more assistance. But it's definitely a lot of education too around like what qualifies as recruitment marketing and helping our recruiters. Because I think a lot of times it's like, okay, well, can we post everything on MUSC Health social media? And so trying to shift that mindset to say, let's use our own networks and let's promote jobs on our own LinkedIn. And so for that in our recruiters landscape, using social media, and then also for our hiring managers and leaders to use theirs too. So it's like, yes, we are doing things and we are trying to help you, but also help yourself. So I think that's another way with us having very limited bandwidth. Because I think there's probably 30, 50 recruiters. So trying to help everybody help themselves, and remember that I'm one person. I'm doing the best I can, I think, is my general everyday state of mind. So
yeah, that's so true, Kendall, and what you said is kind of what Kathleen and I are running into. Just like, it's such an important thing and we recognize that it's important, but it's a gap, it's a staffing gap. So how do we fill it and what do we do about it, and how do we get more miles out of stuff that we're already creating? What you mentioned about like asking people to submit videos, we're kind of exploring that too. And then you run into like, well, they're not very good, or they put a bunch of graphics on it that look terrible, or so like, is it templates? Is it like, what do we do? So we're trying to kind of figure out like a similar solve for what you're describing. So it's, if nothing else, it's just really nice to hear that it's going on other places too.
yes, absolutely. And something we've done to help gather content is create forms. So for better or for worse, I think, we get a little form crazy sometimes, but I have like a form for new hires, one for people who are promoted, and then one for just general care team testimonials. And then we'll also tailor them to different awareness months. So like Nurses Week, Nurses Month, for example, or like, so we'll try to tailor them to the specific awareness and observances. And we try to share those with people. So then it has like some questions that they can fill out, and that gives you written content, help with captions, articles, etc. But then we also will offer the option that instead of writing it, send us a video. And sometimes it works well and sometimes it doesn't. I think sometimes people don't want to video themselves, and I understand that. So definitely a challenge. And if anyone's got that figured out, we would definitely love to know.
Thank you all so much. Thank you, Kendall, Kathleen, and Diet. This was so interesting. And thank you to everyone who got involved in the chat. So we will be sharing this recording along with some other information from today's event on our website. So if you missed anything or want any more information, then we'll be sharing this information that way. And just a couple more notes before we leave today's session. Again, become a CHPRMS member. You'll get involved with this wonderful network of people and learn about more people from your hometown. Apparently, that's what we use this for now. Also, keep a lookout for some of our upcoming events. We've got another event like this coming up towards the end of August, another in September, and then of course our wonderful conference. So thank you again, everyone, for joining today, and I hope you have a wonderful Friday and a wonderful weekend.